We're going to talk today about 211 Information and Referral Service. Who in here knows what 211 is? Okay, has anyone here ever used 211? Wow, practically everyone is going to be fresh with this information. That's great. This is Shannon Huffman, and I'm Scott Payne, and we work for Family and Children's Service. And what we do is we operate the 211 service for 58 counties in Tennessee. We also have a crisis line and other services like Health Assist that we'll talk about a little bit in this presentation, just so you know about them, because they are important resources for the people that you serve. So 211 is a 3-digit number. Okay, it's working. It's available in Middle Tennessee and the state of Tennessee 24 hours a day, 7 days a week. There's exception to a couple of areas. Memphis area has it whenever the public library is open because they are actually employees of the public library. But for Middle Tennessee and the counties surrounding Knox County, we're 24/7. And we provide assistance with social services to anyone who needs it. Go ahead and click. About 12 years ago in Dallas, they did a study on how many times someone had to make a phone call in order to get a human service or a social service. How many calls do you think the average person has to make before they get the service they need?
You said 5. How many?
I've heard 5 and 10. Those are really good guesses. The study that they did 12 years ago said 8. That's way too many. And some of these are very important issues. I want to kill myself. My child is on drugs. We don't want to make 10 phone calls or 8 phone calls or 1 phone call, right, when we have this issue. So what has occurred is 211 was created. 211 is a 3-digit number that anyone can call in the state of Tennessee to get assistance with social services. And when that happens and they call and they say, I want to kill myself, we connect them to a suicide hotline. If their child is on drugs, we set them to the drug rehab center for children. That's what we do. People call us with needs, and we answer the needs. We get about 130,000 calls a year for the area we serve, which is 58 counties. Can you click to the map of the state? All the counties in white are call areas that we answer for. And Tennessee does have 100% coverage in 211. But we're operated under 1, 2, 3, 4, 5, 6, 7 different centers now. At one time, there were 9 different centers. But some of them have gone out of business, and we've absorbed their call area. And the model for 211 is different depending on the call area. We try to give the same service across the state, but we're operated in different ways. I mentioned earlier that Memphis, their operators are employees of the city of Memphis. Our employees who staff the phone are staff, volunteers, and interns of Family and Children's Service. And so we're able to operate 24 hours a day. Since Memphis is in the library, they can't operate 24 hours a day. We're working right now to make it to where we can take their calls after hours. So right now, if you call and the library is closed in Memphis, you get a recording and you can leave a message, and that's fine. But if it was an emergency situation and you didn't know how to call the crisis center, that would be an issue, right? So we are working to improve the service. But it just depends on where you go, how the model differs. We contract with United Way. We're not United Way employees. In the Chattanooga area, that light blue area there, they are employees of United Way. They work in the United Way building. They are United Way employees. We provide the same service. We just have a different service delivery model.
Is that 24 hours a day?
Chattanooga is not 24 hours a day. But they do have, like I said, a way that you can leave a message. Go back to, what do people call 211 about? Basic services. It could be food. It could be clothing. It could be, I can't pay for my medications. It could be, where am I going to send my kids for summer camp? We get all of those calls. And we keep resources in our database. There are 36,000 services, 17,000 agencies that provide resources for the state of Tennessee. During times of disaster, who was here during the 2010 flood? Anyone? Do you remember seeing 211 then? 211 became the line to call during the recovery. And what we did is we mapped our needs by zip codes, And United Way actually used call information from 211 to decide where to place their Restore the Dream centers. It can be a very powerful tool. We cooperate with the city of Nashville and their Office of Emergency Management. We've actually done drills with them. So if there'd actually been disasters last night, I wouldn't be here today. I would be very busy somewhere else. So that's just a thumb sketch of what we do at 211. Are there any questions to this point? Can you go? Are you familiar with the N11 numbers? Does anybody know what I mean when I say N11 numbers? N11 numbers are 3-digit numbers that you can use to call to receive a service. And every number from 2 to 9 has a designated service delivery from the FCC. Everybody knows 911. What about 311? Is anyone from an area where you have 311? Right. What is 311?
That's the local
Government services. Right. Absolutely. Only the metro areas have 311 that we're aware of. 411, directory assistance. Has anyone ever used 511? Yeah, it's a pretty good service, isn't it? You can get information about the state you're going to by dialing 511, and it's really safe to do that while you're driving too. Just wanted to point that out. 711 is used for the relay for the deaf, so deaf people can talk to hearing people and translate information. 811, familiar with 811? If you don't remember anything else I say today, remember 811. If you dig a hole in the state of Tennessee and you haven't called 811 and you hit some type of utility, you're on the hook for whatever it cost. So call 811 before you dig. That's the only commercial I do, I think. And so we do everything else. Now, sometimes your phone won't dial 211. Has anyone ever tried to dial 211 and couldn't make the call? Why do you think that would be, that a 3-digit number wouldn't work from a phone? I'm telling you this because when you go back to your office, you may try to dial 211 and it doesn't work. If it doesn't work, you need to contact your IT people and have them unlock it. Every N11 comes from the factory in multi-line phones locked, except 911 because it's the emergency line. But the reason for that is the N11s used to be dating services and things of that nature. Like 211 10 years ago would be a dating service, and now we're social services and referral. Not as many. And for a long time, the payphones, does anyone remember what a payphone looks like? At one time, you dialed 211 to get a refund, and I have had one of those calls. It doesn't go well when you say, that's not what we do here anymore. Can I help you find a food box? So, the way 211 works is someone calls our office, and we ask them for some information. We usually ask for a zip code, and that's the only thing we kind of require from anyone because it helps us locate the nearest resources. But we also ask for name and phone number so that we can call them back if we do find resources that better fit what they were looking for, and we didn't know of them at the time of the call. And we give 3 referrals for every need that they present, if we can. The Alliance for Information and Referral Services, or AIRS, established the standards that we follow. And to be fair and to be non-favorite to any one agency, we always try to give as many resources as we have. Of course, we don't always have 3 resources, you know. If you need rent assistance in Knoxville, I might have 1, 2, you know, because sometimes they're out of money, and if they're out of money, we try not to give them out either. If we know the eligibility criteria, we're going to let the caller know. If we know you have to live in a zip code to get a service, we're going to let you know. Food pantries often, that's how they determine their service area, is by the zip code. So it's very important for us to get the zip code. Also, any other things that they may need, we try to let them know. If they're going to have proof of birth of everyone in the household under 17, if they're going to a food bank, we're going to let them know you have to take something with you that's going to show the people at the agency that you have the people in your home that need this service. And we try to empower people. If someone calls in and they say, I have trouble dialing the phone for whatever reason, we will try to connect them. But really, 211 is about giving people information and letting them determine which service they want. So we try not to connect many. Any questions?
How about for suicide hotline?
Suicide hotline, in our case, we just take that as a suicide hotline call because that's another service we do at Family and Children's Service. If it wasn't the case, what happens with a 211 call center is we'll keep them on the line and connect them to a suicide center. It's a good question. Go ahead to the next slide. I want to talk a few minutes about the SNAP program. Does anyone know what the SNAP program is? It's food stamps, but now it's called Supplemental Nutrition Assistance Program. We receive a grant from the United States Department of Agriculture for checking with people to see if they're aware of the program. Basically, we're doing promotion for the food stamp program. The reason we do this is because elderly people and a lot of children who are eligible for the program do not receive the benefits. And a lot of misinformation is out there like I'll only get $10 or it's too much paperwork. So what we do is we offer people a pre-screening when they call 211. Basically, it's 14 questions that we can determine within a reasonable, possibility that they're eligible. Sometimes they won't tell us about something and they'll go and they still can't get onto the program. But for the most part, this will give us whether or not it's likely that they'll receive food stamps if they apply. It's just a 14-question screen. And anyone that doesn't want to do it, they don't have to do it, but we just do it to raise awareness of the program because the program itself creates economic booms for communities. Every dollar that's spent in a benefit is worth $1.79 to the local community. And that's economics. I don't exactly know how it works, but the USDA tells me it works, so I believe them. Go back to that one for just a second. So what happens is we would do the screening with someone if they want to do the screening. If they don't want to do the screening, the 211 call just goes on. If they want to do the screening, we let them know whether or not we think they should apply or whether or not they're likely to be eligible. If they are, then we ask them if we can follow up with them. This is what the USDA is actually paying for. They want to know how many people know about the program but don't choose to use the program. So each month we give them an aggregate number of who we talked to, how many of those people had food stamps, how many of those people pre-screened, and how many of those people did not want to pre-screen. And if they'll tell us why, we let them know why they didn't want to do the pre-screen. And people over the age of 62 and disabled people, a lot of times they think they can't get a very high amount, that they think they'll get $16. But if they spend $35 a month in medical benefits, like they have to buy prescriptions or they have to pay for a doctor's visit, whatever, if they have proof that they spend $35 a month, it goes from like $16 to $116 in benefit. So we try to raise awareness for elderly people because they're the people who need nutrition the most who don't get it. Right, right. So it makes a big difference. Any questions about that? Am I rocking around too much? Okay, thanks. One other program we have is Health Assist. What Health Assist does is it helps people overcome barriers to receiving health care. Way back before there was even an ACA, there was a Health Assist. And what we did is we received phone calls from people who didn't have insurance, didn't know their children could get TennCare, didn't know how to pay for prescriptions, didn't have transportation to appointments, things of that nature. And what we do is we assist them in overcoming those barriers. We start a case on them, call them back, give them the referrals just like we do on the 211 side, and we follow up with them to make sure they're using them. As far as like PAP programs, pharmacy prescription programs, we'll fill out the information for them, send it to them for them to sign, and then send it in for them if that's what they need. And it's a free service to the person who uses it, and the helpline is 800-269-4038. Or they can call 211 and we can connect them through. Go ahead. Someone mentioned the crisis line just a minute ago. Excuse me, just a second. We have a 24-hour, 7-day-a-week crisis service. It's for any type of crisis. What is crisis? The pasta got to everybody, didn't it? Okay, crisis is any situation in which an individual finds himself in that they do not feel equipped to address. It might be the loss of a pet. It might be the loss of a spouse. It might be the loss of a job. It might be that they're going to get divorced. Whatever it is, crisis pops up in people's lives. And there are times when people who function perfectly in everyday life feel anxiety and they feel an inability to address whatever situation they find themselves in. So for that reason, 24 hours a day, 7 days a week, we have trained people on the phones waiting to take their calls. The easiest way to get us is to call 244-7444, but we also answer the National Suicide Prevention Line number. Go ahead and click that screen. It's 1-800-273-TALK. So if a crisis arises with someone in your office, we are glad to take your call and to help you negotiate what's going on, especially when they're suicidal, because who in here sees suicidal patients every day? Well, not very many of you. So we are glad to be of assistance. And we have protocols with mobile crisis, with area agencies that can send someone on site if that's what actually needs to happen. We don't actually do the on-site ourselves, but we do have relationships, memorandums of understanding, excuse me, with mobile crisis units. It's a good question. Okay. So this is the first part of 211. Does anyone have any questions about what 211 is, how it works, anything of that nature? If you have someone in your office and you don't want them to leave without them having a suicide assessment, you can call us and just tell us the situation. We'll work with you the best we can. If we can get the patient to come on the phone and actually talk to us, we will do that. If it's a doctor or a nurse, we'll do that too. It's not, you're not going to identify them. You're calling and you're in crisis. You have someone in your office. You can tell us who you are, but you're not going to tell us who the patient is. Patient will divulge that to us if they want to. That's a great question, but we don't have to have that. We do have calls where we talk to people where we never really get the identifying information because they have the right to be anonymous, unless we think they're definitely going to harm themselves or harm someone else. We're very strict about that. But when it comes into call, we have ways of identifying people through phone lines and things of that nature if we need to, but we don't have to have that to help. Now, besides calling in for 211, you can also go online and look at the website. It's 211tn.org. 211tn.org.
So when you look through this, you're going to see that whenever someone calls in the 211, then we will give them descriptions and hours and locations to help the person. And also if there's something that food pantries, they may have to bring certain documents with them. So our call specialists, what they'll do is that they'll look down here, they'll provide description about the service. They'll also provide them description about the hours, intake process. There's also languages. There's also eligibility. If there's specific like counties or if there's specific like zip codes that they serve the individuals. So another neat thing about this right here is that if you go to send, so once you found the resource that you're looking for, you could go to send, and if you're talking with someone, you could email this information to them. If they have a phone, you could send it to their phone, and you just put in their phone number, you put in their carrier, and it will send all that information on their phone. Also, you can email the information to them as well. We do want to talk about, for people who call us, we want to make sure that all the resources are updated in our database. So what happens is that we do have agencies that will go to 211tn.org, And when they do that, they'll have you sign up for an account. And when they sign up in an account, they go here. So what Scott's doing right now is logging in and setting up in an account so that if there's any resources that need to be updated, what they'll do is they'll go in, and if it's maybe their hours of their operation changed, so they will go in there and change their hours of operation, report that, and it will send to our services. So we have 3 resource specialists that will go in and they'll update the information so that that's going to be communicated out to the people who are taking the calls, so that the accurate information is getting out to the community.
So if I noticed that on Nashville Cares, they had the hours wrong, I would just go right here and change the hours. And go down to the bottom and submit. And what happens is we get an email at the resource specialist desk, and it says, whatever my username is, which is S Payne in my situation, says the time is wrong at Nashville Cares. Do I work for Nashville Cares? I told you I work for Family and Children's Service, right? So we're not just going to change it because someone who has an account calls us and tells us. What happens is, or emails us and tells us, what happens is we verify it with the people at Nashville Cares, and if it's really a change, we change. It's a great way to help us make sure we have the right information in the database. And everyone here, when you go home tonight, can create yourself an account, and it's so simple. It only asks for your name, make yourself a username, make yourself a password, and give us an email that we can reach you at. That's it. And then you have all the benefits of having an account with 211ten.org. No one laughed at that. I expected someone to laugh. One of the things you can do when you have an account is create what we call resource groups. If you'll look right there on the screen where the arrow is, there's resource groups. And I just made up some for Knoxville. But if I want to know all the transportation sites in Knoxville, services, all I got to do is click on that, and it's going to come up. If I'm like, well, I don't want to look through all that, and I only need transportation for people with disabilities, I can click on the one that I made for disabilities. You can add these yourself. You can remove them when you don't want to use a resource anymore. And every time we update a resource, it gets updated in your resource group.